Welcome to the Joint Center at Henry County Medical Center. We thank you for choosing our facility for your orthopedic care. My name is Candi Mitchell. I'm an RN. I'm a certified orthopedic nurse, and I'm part of the team that will be helping take care of you after surgery. I want to let you know a little bit about what's going on before surgery so you'll know what to expect. The day of surgery, be sure to ask your doctor which medicines he wants you to take and which medicines he wants you to hold until possibly after surgery. There are some medicines that interact with anesthesia, and there are some things like blood thinners and things that they may not want you to take. So be sure to ask your doctor which medicines he wants you to take that morning. You'll have nothing to eat or drink after midnight, so try to eat you a snack before 12 o'clock because you'll get hungry. Bring an updated list of all your medications to the hospital with you so we can be sure and have an accurate list of everything that you take, even over-the-counter medicines, because that's very important. We need to know everything you take and when you take it and how much you take. And also tell us if you have any allergies or sensitivities to any type of medications or even tape. Some people are allergic to adhesive, and so let us know if there's anything like that we need to know. Please bring with you some loose-fitting shorts, t-shirts, something easy to get on and off. Please don't bring long pants. You'll have a dressing and you'll have drains and things, and it's just easier to work around those things when you have some shorts or something. They'll be more comfortable, and we do want you to be comfortable. You can bring house slippers or tennis shoes if you like, but do know that the leg or the hip that you are having surgery on could possibly swell, and you may not be able to fit into those shoes at that time. So we always supply these little footy socks. They have treads on the back for traction to keep you from falling. So you'll have a pair of these when you arrive at your room anyway. You'll go to when you arrive that morning for surgery, you'll go to the second floor. It's outpatient surgery. Just go to the desk, tell them who you are, what you're having done. They'll put you in a room. They'll get your IV started. They'll go through your checklist and make sure that they've got everything they need, your EKGs and your medicine list and all that. And they'll put you in a gown, and we'll wait for surgery. At that time, they'll take you down to the first floor for surgery. Your family can go to the first floor with you. There's a waiting room on the first floor. It is, when you get off the elevators, it's directly to the left of the elevators, the main elevators. Your family can wait there until the doctor is finished with the surgery. When the doctor is finished, he'll come out and talk to the family, and that's the point that you will be going to the recovery room. So your family, after it talks to the doctor, they can come to your room and wait. Generally, patients stay in the recovery room at least 30 minutes, but sometimes up to an hour, hour and a half. So don't be alarmed if they don't come up immediately. Sometimes it takes people a little bit to wake up from anesthesia. So don't be alarmed, but you're more than welcome to wait in the room after you talk to the doctor. They will call us from recovery room to let us know that you're on your way up to your room. We'll have everything ready for you. One of us will be here to meet you as soon as you get here. We will hook you up to all kinds of monitors and cords and stuff. So I want to show you a few of those things so you'll kind of know what to expect. First, this is what they call a PCA pump. This is a pain medicine. This is an IV pump. You'll have IV fluids running to your IV, and the PCA pump is also part of your IV. It's set, we can set it so that you can give yourself a dose of medicine whenever you need it. This little button here tells the machine to give you a dose of medicine. If you are consistently hitting this button and you're not feeling relief, please let us know, because we want to do everything we can to try to control your pain. Unfortunately, we can't totally take the pain away, but we can help alleviate a lot of discomfort. We use a pain scale from 0 to 10, 10 being worst pain ever, 0 being no pain. Our goal is to keep your pain at around a 3, maybe a 4. So keep in mind that when your pain gets higher and higher, it's going to take more medication and it's going to take longer to get it under control. So that's one of those things that's best nipped in the bud. So as soon as you start feeling like you're a 5 or a 6 or a 7, please let us know, because we do have other alternatives and measures to help you with your pain. Also, in nausea, anesthesia will make people nauseated sometimes. So if you feel nauseated or just a little queasy, please let us know, because we have medications for that too. When you get to your room, you can start with a clear liquid diet. Sometimes anesthesia makes people nauseated, so we start light and then advance as you tolerate. So usually most people will have a clear liquid tray when they first get to the room, and then the next meal is usually a regular diet or diet of choice. If you follow a special diet, please let us know so that we can have arrangements made for you. Another thing you're going to notice when you come back, we'll have an IV pump. Here we'll have a blood pressure machine. We're going to monitor your blood pressure for approximately 6 hours after surgery, because we want to keep a close eye on your blood pressure and your oxygen level and your temperature and all that since you've been under anesthesia. So you'll have a blood pressure cuff on your arm for a while. You'll have the oxygen monitor on your finger. And if you hear any beeping, or if it continues to beep and maybe drive you crazy, let us know, because sometimes they don't pick up what they should, and we want to know about that. Sometimes we can't hear it out in the hallway. So be sure and let us know if there's anything beeping or going off. So another thing I want to show you is there's a computer in every room. This is for the medical staff to use. It has our care program on it. What we do is all of your medications will be administered. I have a barcode, and you also will have a barcode on your bracelet, and all the medications have barcodes. So this is a safety mechanism to prevent patients getting the wrong medicine. So we'll ask to verify your name, your birthday, make sure you have on the correct band. We'll scan your band, and we'll scan your medicine. At that time, we'll administer any of your medicines. Please don't take your own medicines, because your doctor will write which medicines he wants you to continue and which ones he wants to hold after surgery, so that we don't want you getting both medicines. So please don't take your own medicine unless you've spoke to the doctor and the nursing staff, so that we know you're getting the right medicines. Some medicines that you will be on after surgery, you'll be on an antibiotic for the first 24 hours. It's an IV antibiotic, and it runs periodically over the first 24 hours. You'll have a blood thinner prescribed for you to help prevent blood clots. Now, some doctors use a pill form of blood thinner, and some doctors use an injection type blood thinner. But do know that you'll probably go home on one of these blood thinners for approximately 2 to 3 weeks after surgery, depending on which surgery you have. Another thing you might notice when you come back from surgery is you may have oxygen on, and that's just for the immediate post-operative period. Sometimes the anesthesia will make your lungs a little lazy, and you don't breathe very deeply, so when you fall asleep, your oxygen level may drop. That's why we monitor it. So don't be alarmed if you have oxygen on. Usually you can take it off by the next day. So there are 3 very important factors I want to discuss with you right now that we watch for as nurses to prevent complications. The three things that we concentrate on is, first, pain control. You will be asked frequently, what number are you? Where are you at on the pain scale on a 0 to 10? You'll also be offered medication before therapy. Generally, therapy starts about 8:30. So on the first day after surgery, we'll get you up rather early, about 6:30 or 7. will offer you a pan of water to get washed up, wash your face, and get your clothes on. The nurse will give you your morning medicines and will usually administer pain medicines by pills at that time also. Physical therapy will come about 8:30 to get you out of the bed, to walk you, and see how well you do, just as an assessment to start out. So please keep in mind that we are very concerned about your pain and we want to do everything we can to control it. Another topic that we pay very close attention to is the prevention of pneumonia and blood clots. Those are the top two complications that occur with orthopedic surgery. Pneumonia, it doesn't take very long to set in pneumonia. So that's one reason we want you to get up out of the bed. We want you up and moving. Lying in the bed is one of the worst things that you can do for your lungs. We have this is called an incentive spirometer. Respiratory Therapy will bring you your very own machine and you get to keep it. This is yours, and they'll instruct you on how to use it. Basically, it's a tool to help you see how deep you're breathing. We want you to take deep breaths frequently and expand your lungs. You want to breathe deeply until you feel it stretch in your diaphragm. You want to feel it all the way down here. That way you know you're getting oxygen down to the very bottom of your lungs and opening those little air sacs, and you're getting optimal oxygen. So please keep in mind about the prevention of pneumonia. The other thing that is a complication risk is blood clots. Immobility, surgery will automatically put you at risk for blood clots. We'll be giving you the blood thinner medication, and we'll also have you wearing either these little sleeves on your legs, or maybe even very tight hose that go on your legs. So you may have one or the other, but know that these are very important, especially when you're in the bed, to help prevent blood clots. What we want you to do is stay as active and mobile as possible. Please feel free to move about and stretch and roll in the bed. You're not going to pull any incisions. You're not going to hurt anything. It may hurt a little, but you're not going to hurt your incision or your surgery. We have on every bed a trapeze, and you can use this to help pull yourself around. So please don't lie stiff and still in one spot, because number one, it'll make you very, very sore the next day. And number two, it's just not good for your lungs or your blood clots. So feel free to roll, move. The only restrictions that will be placed will be the night of surgery. They won't let you out of bed until you're evaluated by physical therapy. So a nurse will be here to assist you with bathroom and anything that you need. But for the most part, we don't want you walking around yet until physical therapy sees you and evaluates you. Let me show you a few things about your bed and your room. First of all our beds are the same. They all have the trapeze. They have bed controls on both the outside and the inside rails. Buttons to raise the head and lower the head. There's a nurse call light button on inside and outside of each rail. These are the orange buttons that are lit up. Also, you have a remote that has a nurse button on it too. When you push this button, or any of those buttons, it sends off an alarm at the desk. The secretary will answer and come over the intercom and ask you what you need. And please just tell her, and try to be as specific as possible with what you need, whether you need a drink or you need to go to the bathroom or so. That way she'll tell the appropriate staff, and we can take care of you a little faster. We all wear radios, little headsets, so if you see us talking into our shirt, we're not crazy. We're not talking to ourselves. We're actually talking to somebody on an earpiece. But it's our way of communicating with the other staff, and it makes things a lot faster if we need help or if we need something that somebody can bring down the hall. The beds raise and lower also, up and down. Now know that if you have a knee replacement, physical therapy will put you on the continuous passive motion. At that time, the bed will be raised to the level of the machine. That's the only time you can't raise and lower the bed. Any other time, we want to keep your bed low so as not to, so you won't fall when you get out or anything. But at that time when you're on that machine, please don't, and ask your family too, not to adjust the height of the bed. You can raise and lower your head while you're on the machine, but we just can't raise and lower the bed itself. Light controls are on each inside rail. They're the blue buttons, and you can turn your lights on and off, either one. The only light that you don't have control is the bright overhead light. So if someone forgets and leaves it on or something, just let us know. We can turn that off with the switch. It's not a problem. There's a board in every room. We call it a communication board. It's directly under the TV, and it helps us communicate between the patient, the family, physical therapy, the doctors, the nurses, respiratory therapy, social work, and anyone else that's involved in your care. We'll have the name of your nurse for that day or night, the nursing assistant's name, so you'll know who we are. Of course, you'll have your doctor's name up here. We'll have your room number, because it's easy to forget what room you're in. We have a pain scale here, and you can see that we use the smiley faces. We want you smiling. So I don't want to see you like this, but we'll write your pain goal up here, which is normally around a 3 or a 4. So like I talked about before. There's a place for your diet, so you'll know what kind of diet we have you on. Any precautions, like hip precautions or knee precautions. And there's this place here for us to write down the last time you got pain medicine. That way you'll know when it's close to time that you can have more pain medicine. Physical therapy has a spot here that tells you how frequent they will be working with you, any precautions, and this is very useful for the doctor and other staff to let us know how well you're doing, how far you're walking, if you're able to bear weight on that surgical leg or not. And there's also a spot here for questions or that you may think of for your doctor or your nurse, because I know lots of times you think of something and then as soon as the doctor walks in, you forgot it. So you feel free to write messages up here, reminders, so that we can discuss with your doctor any concerns that you have. Your social worker will be assigned. They'll come see you usually the day after surgery to start discharge planning. If you're going to rehab or if you're going home, they'll help arrange all the care when you leave here. Everything from the medication to either home health, rehab, or outpatient therapy, all of that. They take care of all of that. So when you leave, you'll have a plan in place and you'll know what to expect when. I also want you to know that we welcome visitors and family. If you have someone that's able or willing to stay with you, we have a pull-out bed. We'll get you some blankets and pillows and anything you need. There's no problem with someone staying overnight. It's actually very helpful because you have a coach, we call, to encourage you and to help you remember certain things that we tell you that sometimes you're a little foggy after anesthesia and you may not remember. That coach or family member is welcome to come to therapy with you and help you with your therapy exercises, and also they'll help you remember if you've had your pain medicine, or help you remember some of the exercises to work on. Some of the exercises that the nurses encourage, especially while you're in the bed, is foot flexion. We want you to pump your feet up and down like that. The other exercise that's good for you is to try to press the back of your knee down into the bed. And you'll feel these leg muscles here tighten. But that's an excellent exercise to strengthen your legs and also help prevent foot blood clots. So you flex your feet and then walk your knees back and forth. You'll have the immobilizer on if you had a knee replacement, or if you have a hip replacement, you may have the foam wedge, so You may be a little constrained, but you're still able to move and do those exercises while you're in the bed, and we encourage that. One last note, I want to remind everybody, please, please, please use good hand washing. We want to prevent infections of any kind. So if you have someone that's sick and want to come see you, or we ask that you not let those visitors come in, because we don't want to contaminate you or anyone else. There's a sink in the room here. It's got antibacterial soap. There's also a can of antibacterial foam that you can use. You just get a squirt, rub it on your hands, and then they dry, and that will disinfect your hands. We ask that you please don't touch your incision sites or pick at your dressings or anything. We don't want to do anything to introduce any infection or any germs into that incision site. Keep it clean, keep it dry. Your doctor will tell you how to take care of it, especially right after when you go home. We just want to make sure that we do everything we can to prevent any infection or complications. Lastly, please know that there's no smoking on our campus, on the whole hospital campus. If you do smoke, now's a good time to quit. Smoking slows down bone healing, so keep that in mind. If you come in and you've made it a couple of days without that cigarette, see if you can't continue to go without it. We can offer you a nicotine patch if you'd like to help, but there's no smoking on the campus, so you leave your cigarettes at home. You don't need them. I think that covers just about everything we want to tell you about. We hope you have a great stay here. We want to thank you for coming here and trusting us with your care. And we'll do everything we can to live up to your expectations, because we want a positive outcome for you. Thank you.